Most of us have experienced some form of swelling in our feet or ankles, perhaps after a long day of standing, a strenuous workout, or during travel. It can feel a bit uncomfortable and often resolves on its own. But how do you know when that puffiness might be a sign of something more serious, signaling that it's time to reach out to a healthcare professional? While occasional, mild ankle swelling is often harmless and can be due to temporary factors, you should see a doctor if your ankle swelling is sudden, severe, impacts only one leg, or is accompanied by other concerning symptoms. These signs could indicate a more significant underlying health issue that requires medical evaluation. The core reason behind ankle swelling, medically known as edema, is often an accumulation of fluid in the tissues. In many cases, gravity simply causes fluid to pool in the lower extremities, especially after prolonged standing or sitting. However, when this natural fluid movement is disrupted due to conditions like a weakened heart, fluid can back up, leading to noticeable swelling. Your heart's job is to efficiently pump blood throughout your body, and if it struggles, less blood returns to the heart, causing fluid to leak into surrounding tissues. To determine if your swelling warrants a doctor's visit, pay close attention to its characteristics. Look for swelling that appears suddenly, especially if it affects only one leg. Note if the skin over the swollen area looks stretched, shiny, or discolored. You should also watch for other symptoms like chest pain, shortness of breath, unexplained fever, redness, warmth to the touch, or tenderness in the leg. If you press on the swollen area and an indentation remains for a few seconds, this is called pitting edema and can also be a significant indicator. Recognizing specific signs like one-sided leg swelling combined with pain could point to deep vein thrombosis, or DVT, which is a blood clot that requires immediate medical attention. Another key indicator is pitting edema, as mentioned, which signifies fluid retention that might be linked to cardiovascular issues. It is important to know that while some medications can cause mild swelling as a side effect, any persistent or concerning swelling should always be discussed with your doctor to rule out more serious causes. Understanding these key distinctions about ankle swelling empowers you to make informed decisions about your health, potentially catching serious conditions early when they are more manageable. This knowledge helps you understand when a self-care approach is appropriate and when it is vital to seek professional medical advice for proper diagnosis and treatment. Always remember, this information is for educational purposes only and not a substitute for professional medical advice from a qualified healthcare provider.